Are you addicted to coffee? Probably not, according to the best psychological definition. Now, not everyone gives in to an addiction, but we've all experienced urges to do things that go against our better judgment. Understanding these urges and how to undo them is the topic of today's episode. I'm Sharif Yunus with Dr. Kevin Majors. This is The Golden Hour. We're here for our episode for August 31st. I'm Sharif Yunus, here with Dr. Kevin Majors. And, well, one thing is that we're in person talking together, which is for the first time in a long time.
It's kind of rare. It's also rare that we have construction in the background, so sorry in advance for any noises.
Yeah. So, and we want to talk today about addiction and what's going on there. So, Kevin, you've worked before with patients dealing with addiction, and then it also just has a lot, the theory kind of underlying addiction also has a lot of implications for how we work and how we deal with situations in everyday life. So, first of all, what is addiction, technically speaking?
Yeah, that's a great question. Addiction has been defined in different ways over the years. One of the definitions that cognitive behavioral therapy had settled on is any repeated, anytime you repeatedly give in to a craving in which the cost outweighs the benefits.
Okay.
So the idea there is that there's a cost-benefit analysis, and yet the repeated behavior is driven by cravings. Mm-hmm. So you have repeated behavior, you have cravings, and then you have this cost-benefit analysis. The idea being that there could be a moderate use of something.
Like coffee, for example. The cost doesn't outweigh the benefit. So when people say, I'm addicted to coffee.
Yeah, exactly. Then you would say, okay, well, what are the costs? And then what are the benefits? The benefits are, well, many times it helps us to work well. Okay. And the cost is, well, you get maybe a headache if you go without it. And a lot of people are worried about coffee because if they have it every day and then they don't have it, they have a headache. Sometimes people think that withdrawal like that is a sign that you are addicted. That is completely not true. So blood pressure medicines have withdrawal symptoms if you just stop them. It's just that the body gets used to things. And if you suddenly go without it, the body has to adjust. And sometimes that adjustment causes like a headache or some other symptoms. So withdrawal is not what makes an addiction. But this idea that when the cost outweighs the benefit, another way that I like saying it is that an addiction is when you violate your ideals because of a craving. Because if you're going against your ideals, then it's obviously always the cost outweighs the benefit. Mm-hmm. So when people have addictions that make them act in ways contrary to their kind of the moral vision of life that they really want to be living according to, okay, then I say that's an addiction. So it's a repeated behavior, in which you violate your ideals or go against your ideals because of a craving. So things that can be done in moderation then would be done according to your ideals. So it wouldn't be a problem. So the problem is that what happens when people are captured by a behavior or by a substance, so that now it's distorting their life. And they feel that they're just like somehow out of control, when it comes to this behavior or this substance. And at that point, giving into it does go against their ideals. They feel like they're not in control, they don't want to do it, and yet whenever the opportunity comes, they end up giving into it.
Mm-hmm. So this might seem like a trivial example, but is like, would you say a person is addicted to YouTube or Facebook if they're constantly checking throughout the day?
And especially
if they're getting distracted from their work by it and they just give in.
I think there could be a good argument that if you're really kind of going against your ideals, in this case work, because you have repeated cravings to do something like check Facebook or YouTube, then yes, that does have the dynamic of an addiction. So addiction means that cravings are taking you off the path that you are deliberately trying to commit yourself to.
Mm-hmm.
So that your commitment is somehow undermined by the craving. That to me is what, even colloquially, I think that's like what we would call an addiction.
Yeah.
But, feeling like that you need coffee, I don't think that's an addiction.
Right.
Could exercise be an addiction? Some people think they're addicted to exercise because if they don't do it one day, they feel bad.
Yeah.
I would still hesitate unless it's really causing them to, somehow it's warping their life.
Right.
And I have known people that are spending 2 or 3 hours a day exercising and, wouldn't go like to family events because it interfered with their, like even a funeral, because it interfered with exercise.
Yeah.
And that would be then more like an addiction.
Right.
So you have to see, are you willing to sacrifice people, and what matters in life for the sake of this?
Mm-hmm.
And then, yes, that would be an addiction.
Mm-hmm. So that's like distinguishing it from, we distinguished it earlier from dependence, like when you're dependent on caffeine or exercise, and then also from a habit,
mm-hmm.
where you get the like if you go against a habit in one case, you get the feeling that, you shouldn't, or so
addictions are habits, but they're habits of going against your ideals.
Okay.
So they're vicious habits in that sense.
Yeah.
And it gets easier and easier to do that. So addictions are always a vicious cycle.
Mm-hmm.
You can have good habits too that are virtuous cycles, which builds up and gets easier and easier.
Okay. So how much is actually known about the neuroscience of addiction, of like what's going on with the brain? Actually, this is kind of interesting because is like what's going on in your brain different in the case of an addiction with just a dependence? Because the difference is the ideal, but it could be, the addiction seems like the brain part of it is just the same as a dependence. So is that...
When by dependence you mean like to taking a blood pressure medicine?
Or drinking coffee.
Or coffee.
Yeah.
Yeah, I think because you actually have dopamine involved.
Mm-hmm.
And the dopamine reward circuits are what are driving addiction.
Mm-hmm.
I think that, but the neuroscience, it gets kind of complicated as you try to talk about how these reward circuits actually work. But if I were to be really big picture,
Mm-hmm.
thinking of it, every time a person uses an addictive drug, and so, take a person, say cocaine or heroin or something, clear examples of drugs that for most people would be highly addictive. Okay, so if a person were to be using this addictive drug and they get a huge high from it, that high involves dopamine, so it becomes very powerfully kind of built into their brain that this reward circuit has been reinforced. And then reward circuits are funny because they have to be maintained. And if the way to maintain it is with the repeated pleasure. So when the reward circuit is on the verge of degrading because it's been neglected, then the person starts feeling a craving. The craving, in a sense, is the reward circuit on the verge of breaking down. So that it gets kind of twitchy and irritable and quick to get triggered. But that's because it needs reinforcement. So the person starts craving the thing, whatever it was that built up the circuit. And then if they give into it, it's satisfied and they feel this relief that comes in. The relief is the reward circuit being kind of filled up again.
Uh-huh.
And so now they've fed it. But the reward circuit gets stronger every time you feed it. So it's a trap. So the next time, it's going to be even more powerful when it gets twitchy and irritable because it needs reinforcement. So they give in again. So you end up with this very powerfully built up reward circuit that whenever it needs reinforcement, produces a very powerful craving. Okay, that's dangerous because the craving gets so powerful that as soon as it's triggered, people start to automatically act on it.
Yeah.
And so it feels like they're powerless in the face of it. But what makes them powerless is actually their relationship to the craving itself. In my experience, if people understand that when you're feeling a craving, the reward circuit is actually on the verge of degrading, that gives people the confidence to get through it, go through the little storm if there's a storm, and there can be a bit of a storm, But then it actually degrades and resets to a new point. And then it could be, so if they had been reinforcing it, say, every week,
Yeah.
well, if they're going to get a storm, and if they get through it, then the next week's will be less, and the next week's will be less, and the next week's will be less. And that's how people get through these. And really, it's just the first couple big storms that are the most difficult to get through.
Mm-hmm. And so that's the reframe.
That's the reframe. It's a neural reframe. That when, no matter, if you have a repeated behavior driven by cravings that violates your ideals, you need to see the craving as the cure. The craving itself is the reward circuit calling for reinforcement lest it die.
Yeah.
So you have to then say, oh, this is perfect. Let me get through this. And the best way of getting through it is by reframing it and being mindful in the face of it.
Mm-hmm.
If you activate your parasympathetics with reframing it as an opportunity and then being completely open to the sensation, the discomfort of the craving, you actually undo the automation drive.
Mm-hmm.
So you can overcome the automaticity through mindfulness and reframing of the craving itself. See the craving as the cure, welcome it, feel it. As you feel it, you don't get controlled by it. You just ride the wave until it goes down and down and down.
Right. And one of the reasons why people will give into the craving is because it's uncomfortable. The feeling of the unfulfilled craving is uncomfortable.
Yeah, it's painful, and it feels permanent. And that's just the way all these things are, that when you have a strong emotion of any kind, and a craving is just it's a desire, it's a type of emotion.
Mm-hmm.
When I say craving, it's simply a strong desire. Yeah, they always feel permanent.
Yeah.
It's actually, your body cannot maintain the state of craving for long.
Yeah.
It's just like an expensive thing to do when it comes to the neurocircuits.
Mm-hmm.
See, these dopamine circuits are kind of expensive real estate in the brain. You don't have that many of them.
Mm-hmm.
Okay, one of the problems with addictions is all of the dopamine gets kind of co-opted into this reward circuit. So if you have a very powerful craving, that craving is at the expense of enjoying ordinary life, enjoying ordinary things. See, ordinarily, if you do, like, say you do great work on some project, and you get the sense of satisfaction afterwards, that actually is dopamine. And doing good work should continually give you a sense of satisfaction.
Mm-hmm.
And spending time with family and friends, with people you love, gives you a sense of satisfaction. But that's all dopamine mediated. The problem is, when people have addictions, that whatever that thing is that they're addicted to, that reward circuit co-ops all the dopamine. So now it's just dedicated to that thing, and they don't enjoy ordinary life.
So that's the only thing that would give satisfaction.
Exactly.
Is giving into that craving.
Yep. You just have a limited amount of that. And so satisfying addictive, cravings has a high cost for ordinary life and work. Mm-hmm. And that's why it's relevant to what we do in optimal work. Because you need, even to attain flow, dopamine is involved in that, and the enjoyment that flow gives you. So even small cravings and things, if, can lead people to make subtle sacrifices, and it kind of creeps up on them.
Yeah.
But gradually they realize that this thing is taken over.
Yeah.
And it's what their heart is most set on, and that's the issue.
Yeah. So what are the more common cases where this would play out in work? I mean, I had mentioned getting addicted to YouTube or to Facebook or something where, you'll just get pulled in, you'll get bored with the task and then go on YouTube and then end up spending an hour there or two.
Yeah.
So is that going to be the most common case? Where
I
this
think in
type of
some
thing pops
sense,
up?
that's the paradigm of addiction.
Mm-hmm.
That you actually have an urge that pulls you off task. So you've committed to a task,
mm-hmm.
and the urge pulls you off. And then wait, isn't that that's kind of exactly what happens with addiction? That you have a commitment in life, and urges pull you off. That's why I think that learning to work well, committing to a task, reframing it, bringing all your attention into it, and then challenging yourself, teaches you precisely the steps of overcoming any addiction or any kind of addictive behavior. Now, obviously, if people have, there are certain types of addiction, like with opioids or particularly things like alcohol, where if it's really serious, you need medical supervision, to get through it, because you can actually have some substances opioids, not so much, but alcohol, yes, can have a
Uh-huh.
life-threatening withdrawal.
Okay.
But I'm talking about here the addiction dynamic,
Uh-huh.
which is that isn't a distraction simply an urge to switch tasks? And isn't giving into urge just like a craving?
Yeah.
So I think it's all fundamentally the same thing.
So you think there might be like a YouTube reward circuit?
Absolutely there is. Yeah.
That
And
needs to get
so,
fed.
yeah, people are like, the fear of missing out and constantly needing to check, social media.
Yeah.
Yeah. That's very much a craving that continually pulls them off track.
Yeah.
That's why when people sit down to work, the better they are at committing to the task, setting a perimeter, the more they're actually increasing their ability to control urges.
Mm-hmm.
You don't suppress the urge. The urge, you have no control over the urge occurring. So controlling an urge doesn't mean that it never comes. See,
Right.
part of the problem is people think that when they have a strong craving or urge, that they're already defeated.
Yeah.
When in fact, they're on the verge of victory. They just have to not give into it in that moment. But you get to practice that in work. So to build up the core components of self-control, work is perfect.
Mm-hmm.
And you get to practice it again and again. And if you can do a golden hour, you can, I believe, take control of your life again.
Mm-hmm. So that's a good reason to do golden hours, right?
I would think so.
Take control of your life again. That
Yeah.
seems pretty good.
Yeah, I think it's kind of a beautiful thing that the exact steps you use for helping people overcome anxiety,
Mm-hmm.
reframing, mindfulness, embracing the challenge, those are exactly the steps that get people also through addictions.
Yeah.
That's why cognitive therapy is used for addictions, mindfulness is used for addictions, behavioral therapy is the same steps.
Mm-hmm.
But also, it's true that with real addictions, there is a phobia involved. There's a component of the addiction that actually is having a phobia of a craving. People are so afraid of the craving that they try to stay ahead of it by giving into it. But the craving is nothing to be afraid of. It's simply a moment of discomfort.
Yeah.
And when they experience it, if they welcome it, they realize, actually, it's not even that painful. It's not that bad.
Mm-hmm. Should you look forward to the
Ideally.
craving as this is my opportunity to defeat the
Yeah.
addiction?
Yes, that doesn't mean, however, that you necessarily want to bring the craving on.
Yeah.
So trying to bring on the craving by putting yourself in the situation where it would likely come up can work for substance addictions, but not behavioral ones.
Mm.
Because it could be signaling, I really want to do this. I really want to do this behavior.
Mm-hmm.
And so that's why I'm approaching. It's a mixed signal.
Okay. So you might even be reinforcing the reward circuit by putting yourself
That's
in the
tricky
situation.
thing. Yeah. So just like with anxiety, when you have a strong fear, it makes you want to flee the situation.
Yeah.
Then you do the opposite by approaching it. But when it comes to addictions, if you have a very strong craving,
Mm-hmm.
you actually want to get away from giving into it.
Right.
Put distance between yourself and giving in.
Right.
As a sign that you are committing to not giving into this.
Mm-hmm.
But I think when it comes to work, what that really means is just trying to put up a perimeter before you start. That you reinforce it by putting your phone on Do Not Disturb, and by closing browser windows you're not going to use, clearing things off your
Yeah.
desk. So you make these clear signals. You always have to ask yourself, how is my brain reading my behavior? Does it see me, afraid of something and fleeing it? Then I need to give clear signals that I'm embracing it.
Mm-hmm.
Does it see me dallying with something that I might want to give into? Well, then I need to give clear signals I don't want to give into it.
Right. So then it's not just about in the moment of the craving that you can shape the craving, but also just in your behaviors of how you're like setting up your golden hour.
Commitment. Every behavior you take needs to show commitment.
Mm-hmm.
And that's one of the advantages of a golden hour is you're making a strong commitment for the next, 45, 90 minutes. That strong commitment that you hold is the key. So you do what you can to minimize things from occurring. But if in the midst of the golden hour you still get some very strong urge to check something,
Mm-hmm.
then you rejoice in it and you don't give into it. This is exactly how I reset myself with regard to this urge to overcome it.
Right. Okay. And so it sounds, it's almost the flip side of anxiety. Like it's kind of the mirror image of it. Is it the same neuroscience involved with the amygdala and the appraisal cortex? The amygdala is doing the automatic behaviors and and you're using your appraisal cortex for the deliberate response to that, or is it?
It's a little richer, I think, because that system of the model of anxiety, where it's all about the amygdala detecting threats and sounding the alarm, I think that doesn't involve dopamine reward circuits.
Okay.
The dopamine reward circuits have a lot to do with what we call salience. Salience is the pull power for your attention. So the more salient something is, the more it pulls your attention towards it.
Mm-hmm.
Well, addictive things by their very nature are highly salient.
Yeah.
So now, threat is a type of salience, and so it just depends on the person's behavior. So, if take for instance a hypodermic needle. So if a diabetic person sees a hypodermic needle, they might not think anything of it at all. It's just there, and it's not a big trigger of anything because they use them all the time to inject insulin. If someone with a needle phobia walks into a room and sees a hypodermic needle, he might freak out.
Yeah. Faint.
But his attention would be radically pulled to the needle. That's the kind of salience that a threat can have. But someone who had been addicted to heroin sees that hypodermic needle, their attention is pulled to it in a different way.
Yeah.
And that's the kind of the more true sense of salience, which is all about driven by reward.
Mm-hmm.
And so then they would keep going back to it, and that be more. And so Facebook can be very salient for people.
Mm-hmm.
Anything that you've given into that gave you some kind of reward and relief, then is going to be more salient in the future.
Right. And so we want to train ourselves so that work or living according to our ideals is what's salient.
Yeah, in some ways, the process of growing your character is making higher things more salient.
Mm-hmm.
So ultimately, the people in your life, so they are salient. Your relationships are salient. And then being loving and serving is very salient.
Mm-hmm.
So, and then being patient and kind and cheerful becomes salient. So all those higher qualities, which these kind of very right brain qualities, you want the right brain qualities there to be very salient.
Yeah. Great. Well, that's all we have for today. I mean, do you have any final thoughts to add?
No, I think that only say that work is always the context where we can obtain the growth we need. And I believe that no matter what the issues that people face, that there is a kind of template in an hour of work that teaches you the basic skills to grow in.
Mm-hmm. That's awesome. I'm gonna do a golden hour ASAP.
Good.
Okay. Cool. Thanks so much. We'll be on next week. Well, next Monday is Labor Day. Maybe.
Yeah, we'll have to see what we do.
We'll see what we do. Okay. Thanks so much. Well, thanks so much for listening. I hope you enjoyed the episode. Don't forget to check out optimwork.com for a set of online tools to help you engage challenge in your life. See you next week.